What are some things that Respecting Choices teams and other communities and other organizations can be doing to make a day like this successful? What are some of your suggestions about activities they could be doing or promoting to make a day like this successful, in your eyes?
I think there are a lot of ideas. I'll start with a couple. I have done sessions where I focus on what is the role of a healthcare agent. Rather than focusing on let's just get the document done, let's choose someone, those are all really important, but what is the role of a healthcare agent? We have a lot of individuals caring for their elderly parents who are actually in that decision-making role. They've already been assigned or delegated that responsibility, and it's very difficult. They're often not given a lot of guidance on thinking ahead. Let's say their parent has advanced dementia, and the healthcare providers could help those agents think ahead about what kinds of decisions may be coming down the road. How does a healthcare agent who's never talked to their loved one make decisions? And we know many times those conversations don't happen, so I think it would be really fun to do a kind of program that looked at what is the role of the healthcare agent, how can they start preparing themselves to make some tough decisions down the road, and again, know what local resources might be available for them to go and really help them make decisions that they can live with for the rest of their lives. I think that would be a really good activity to do.
Sure. That sounds like a great one. Dr. Hammes?
I think health institutions, hospitals, nursing homes, hospice programs should express to the community the degree to which they honor advance directives. They might say, you know, when patients come to us and they're very ill, we look for these documents. We try to obtain or have these documents. And I think they should give a report to the community about how successful they are at assuring that the advance directive is available and the fact that they follow that advance directive. So if we're encouraging people to do this planning, which is extremely difficult, it's uncomfortable for people, we should be telling them that we will in fact honor these and perhaps give them a report about in the last 2 months we had this many deaths at our facility, so a certain percentage of them did or didn't have advance directives, and when there were advance directives they were followed, and explain what that means. I think another thing they might do is to try to find a family member who went through this process of planning, decision making, and then and to talk about that experience and how the planning actually helped them play the role of the healthcare agent or decision maker and help them personally. I think those kind of personal stories will motivate others to do this. What's the value of doing this if it isn't for yourself and for your family? And to get someone to testify, to give a testimonial about that, I think is another very powerful thing to do. It's something that a newspaper would likely be happy to publish because it would be of public interest on this particular day.
Wonderful.
Yeah, we have a wonderful Making Choices video and has a vignette in it. It's called the Carol Goodman story. And it's about a woman who was placed in a decision-making role for her mother who was very sick. She had to make decisions in the middle of a medical crisis. She didn't have time to talk to her siblings. And she made the decision that she thought was best. But in retrospect, it wasn't the decision that her mother wanted her to make. And she felt very burdened about it. She told the story in retrospect, and it was very emotional. So that concern about the ongoing grief and stress that a decision maker feels, that says a lot to people who are looking at that and saying, I wouldn't want my daughter to be in that position. So it might be what we call an engagement strategy. It might help motivate me to talk to my daughter. So those kinds of strategies to get people thinking, why should I do this work? What's in it for not only me but my family, the health of my family, versus just an educational program on the differences between living wills and advance directives. I actually think another strategy that might be really helpful for Healthcare Decisions Day is to think about, for healthcare providers, to think about whether or not they've walked through the advanced care planning process themselves. We've, in our own organization, as well as some of our teams, have focused on healthcare providers as their initial step to help healthcare providers think about who they would choose, have a discussion with someone they loved about advanced care planning, and by really seeing that it can be more difficult than they think. And as they walk through that personal exploration for themselves and their family, they not only give a gift to their family, but they learn about some strategies that they can then pass on to their patients and their families. So in our advanced care planning training, it's a prerequisite for people to have gone through this work themselves. If they're going to be advising others to do it, they actually have to go through this work themselves. And that might be a really nice challenge on Healthcare Decisions Day for every organization to say, how many of our doctors and nurses and social workers actually have gone through this? And maybe we should start with our own home, and in that way let it trickle down and help others as well. One of the things that we hear from our teams who implement basic advanced care planning, they'll go out into the community and people will say, well, I've already done that. So on Healthcare Decisions Day, they may ask people to pull out your document, read it, see what it says, ask the question, what do I hope this document will do for me? And start thinking about maybe this isn't enough. And that may be a very helpful thing, rather than just focus on how many documents get completed on this day, how many documents get reviewed. But they're going to, people who engage in Healthcare Decisions Day activities are going to have to help people with that, again, because many people will put it aside. So helping them think about, what do you hope that document does for you, may engage them. We like to use the word engagement rather than just tell people what they should do, but really engage them in why planning is important and why it's helpful to keep it alive and well as you continue through your health and your life.